So, okay. So before we kind of introduce the organization, I wanted to introduce myself. My name is Sonia. I'm the founder and president of Medical Wonders. I'm 18. I'm going to be a college freshman soon. So we just wanted to talk more about Medical Wonders. So we're a student-led and soon nonprofit organization to educate and advise the students about the astounding procedures, careers, discoveries, and more. So we have a lot of people involved in our team. We have 4 major executive teams that work to publish weekly articles depending on our medical monthly topic. We have 50 tutors and 10 college overseers, and we have about 200 plus members, and that's not all that we do. We have a panel team that works to kind of assemble all of these medicine week and panel monthly things that we do. And we have event coordinators, social media managers. So there's also a lot that goes into Medical Wonders. And these are just our stats. Last year we had 200 people involved when we hosted our medicine week for this last year for the first time. This time we have 300. So as you can see, we're constantly growing. We've reached a lot of nonprofits and kind of collaborated with them. And we have about 4.3 thousand followers. So what is Medicine Week? If you guys don't already know, every day this week, a medical professional or student will go on Zoom with us for an hour, presentation, introductions, and Q&A session. So depending on what they decide or how they want to do something, it's kind of a learning experience, so to say. And for panel board descriptions, make sure you check them out on Instagram. We have kind of a breakdown of everything, and we've also tagged everyone. So if you have any questions, maybe later on, you can always reach out to them on Instagram or anything like that. So how does this whole medicine week shadowing hours work? So as you can see, you guys should have gotten an email on for Google Classroom and the Zoom links to join. So you have to definitely be joining the Google Classroom to get the credit, because that's the only way that you're going to be submitting the 5 to 6 sentence paragraph of what the calls are talked about. If you have to attend 2 or more calls this week, and each call is 2 hours. So if you attend all, you'll easily get 10 hours of shadowing. And we'll be marking down the Zoom attendance, but getting hours is on you. So we're really only looking at that 5 to 6 sentence paragraph about what the calls are talked about on Google Classroom. And you have to join that. That's probably the most important thing. Everything else you can find on that Google Classroom, but you have to join that. And when submitting the call, make sure you put your full name along with the paragraph, and you'll get a certificate for however many hours you did, as long as you attended 2 or more calls this week. And we'll also be recording these Zoom sessions and putting them up right after Medicine Week is over. So you'll have until next week, end of next week, which is August 13th, to submit everything in. So if you know a friend or someone that missed it and is on the Google Classroom, tell them not to worry, because we will have all of the Zoom calls up on our YouTube, which we'll show you later how to access that. And how to list on resumes and applications, learning about the different career paths, professions, college plans, and how to get into your specific program, get advice from professionals and students about study habit, MCATs, and other important exams. There's an error on here, and it says that 14 hours. It's actually only 10 hours, which I will further clarify in Google Classroom. And yeah, so this is our YouTube. You can literally just type in Medical Wonders and it'll pop up. We have more videos uploaded and more followers. So you can see that our medicine week from last year, all of the videos were also uploaded. So if you're really interested, you can't get hours for last year's, but we had a lot of different medical professionals coming and talk about their experiences and stuff. So if you're open to that and looking at our other stuff, make sure you check out our YouTube. So I see 2 questions in the chat. If we can't join the call, can we watch the recorded and write our paragraphs, still get ours? Yeah, so that's why we're leaving up the Zoom and the Google Classroom assignment up until August 13th, because we understand that, summer's busy and sometimes you can't really attend all the calls. So the recordings are going to be posted on YouTube, and we'll have a link to that once we start to get it rolling, but we're a little backtracked on that. So we're hoping to get at least the first 2 recordings, yesterday's and today's, out by the end of today. No, so you guys can't get hours from last year's medical week. I said that you guys can just go back and look at it and, depending on if you want to look at our last year's medical week and see what else we're up to, you guys can look at that. But you can only get hours for this year's medicine week. So if you guys want to keep updated and if there's any medicine week stuff that you want to see, make sure you check out our Instagram. Obviously, it's changed from now. This is a really old screenshot, but if you just type in medical.wonders, you'll be able to find it, and you'll also see the rest of our panel people, and yeah. And also make sure you follow us on TikTok, as we are posting a lot about new opportunities too. And on our stories, we actually have random applications that are unofficial, whether it's for graphic designing or being on our podcast and stuff like that. So definitely view our stories as well. So it's really important that you guys follow us. Okay. So if you guys have any other questions, just find me at, that's my @ right there, or Medical Wonders, or you can just email us. And now I'm going to stop sharing and I'm going to introduce our guest, Dr. Tellez, if you want to take over. But I just wanted to say thank you so much for coming on, and we're really excited to see what you have planned for us.
Yeah, thank you for having me. I appreciate it. Let's see if I can, let's see. Oh, I'm just going to try to share my screen for a second. Okay. Can everybody confirm for me in the chat that they can see the sort of pink PowerPoint presentation?
Yeah, we can see it.
Okay. All right. So I'm Marcus, Dr. Tellez. Thank you for having me for this Medical Wonders Shadowing Week. I'm going to be going through my presentation. It's not super in-depth. Feel free to put any questions in the chat, and I like being a little bit more interactive. So if you have questions throughout, feel free to type them in, and I'll try to address them as we go through. So an introduction to me. Before I start talking about myself, I just want to know a little bit about y'all in the chat. Your age, what are you currently doing? Are you pre-med, med? And what sort of interests do you have within the healthcare field in general? And if you don't feel like typing anything, that's also fine too.
I can go.
Okay.
But I'm Sonia. I like I said, I'm going to be a college freshman. I'm studying biomedical engineering, and I'm on the pre-med path. So yeah.
Pediatrics is fun. Okay. So let me talk about myself for a bit. I was born and raised in Tampa, Florida. When I was a kid, I really didn't know exactly what I wanted to do. Obviously, went between vampire, mermaid, mad scientist, doctor, pop singer. Realized the majority of those weren't viable career options, and I couldn't sing. So I went with being a doctor. Looks like we have some people from Canada, emergency medicine. That sounds very fun. Uh, Puerto Rico, rheumatology, also very important. Good. I went to the University of South Florida and I got my degree in religious studies, actually. Originally, my degree changed quite a bit. I was going from biology to chemistry to biochemistry. I did a lot of religious studies extracurricular courses. And so in addition to doing those courses, I did study abroad programs during my undergraduate time in Australia and Spain. And so that I was able to graduate on time within the 4 years of undergraduate and do my MCAT on time, I just stuck with the religious studies degree. I did all my prerequisites for med school, did my MCAT, and I was able to get to med school after that. Looks like we have somebody from the UK and interested in anesthesia. That sounds great. Um, so I did my traditional US 4 years of undergraduate education, but I decided to take a year off in between then and medical school just because I had a bit of a traveling bug. So I went to India for a month and I joined this organization where you get to shadow different doctors and different specialties in India. I went to Australia again for another month. And then the month prior to starting medical school, I had severe anxiety with public speaking. So I did a 200-hour yoga teacher training course to get over that public speaking fear. I did my medical school at Nova Southeastern University in Fort Lauderdale, Florida. I did my residency through the University of Central Florida in Gainesville, Florida. And then after residency and all of my medical school training, I decided to move out to Los Angeles, California, and got my first job as an attending. So as a family med physician, I just want to give you a little perspective on what my day-to-day looks like. Um, Typically, I wake up 20 minutes before work only because I live 10 minutes away. As a family medicine physician, I would say that family medicine is a little bit more laid back than some of the other specialties. Um, Emergency, surgery, all of that stuff is great, but for me, it's just a little too fast paced. I'm a little bit more easygoing. So for me, that's why I went with family medicine. I see a wide variety of cases and patient diversity, whether it's chronic medical conditions like high blood pressure, diabetes, high cholesterol. Talk about preventative care, so your vaccinations, mammograms, pap smears. I love family medicine and primary care in general because it's a mix of getting to see your patients and doing medical management, and you get to do some procedures every now and then, so you get to be hands-on. As a family med physician, I'm also trained in HIV management. I got extra training for that. And then on my own, I've gathered information and have been working with transgender and non-binary patients for hormone therapy as well. Uh, for me, I'm very vocal and active as a queer physician to providing quality care for the LGBT plus community. It's not something that I was educated on during undergraduate, during medical school, or really much during residency. So it was something that I took a particular interest in and started going with. Um, and then the only complaint I have about being a family medicine physician is the constant fighting you have to do with insurance companies to get coverage for your patients, for their medications. Other specialties have that too in different aspects, but I think in primary care and the outpatient setting, you definitely deal with it a lot. Um, so as I was saying, as a family med physician, one of my big things that I love to talk about and promote is LGBTQ plus health. It's not something that I got any education on while I was in medical school, actually, at least in the curriculum of medical school. So when I was doing my fourth year rotations, a physician gave me a medical journal and it had this article from the Cleveland Clinic about LGBTQ plus health. And truly it was, even as a queer person, it was the first time that I was brought to light about LGBTQ plus health disparities. And so I'm not going to read this slide word for word, but I thought this was a really well put together article by the Cleveland Clinic. I have the author and the name of the article if you want to look it up for yourself at the bottom of the slide. But just for me, these are things that I find to be common sense sort of stuff. But as I started having these conversations with other healthcare professionals, I realized that it was not just common sense. It's some things that people do have to be educated on and be aware of so that they don't create more disparities within our healthcare system. Uh, oh, someone is in the waiting room.
I got it. Don't worry.
Okay, no worries. Um, so yeah, I mean, it seems like a lot of you are quite young, and so you haven't quite gotten to the medical school sort of aspect yet, but uh, LGBTQ plus health issues are a growing issue within healthcare, and it's starting to gain more traction. So I wouldn't be surprised. I wouldn't be surprised if at some point throughout your training and your career, you do start hearing more about this in curriculums. But as of right now, I've talked to a lot of people within healthcare, and it's not something that they ever get taught within their curriculum. Um, just as a general, just statements, I guess, from lots of studies, particularly these Healthy People 2020, so it's very recent, LGBTQ plus individuals have higher rates of mental health. And I like to reiterate to people, it's not, being queer does not predispose you to being mentally unwell or having mental health issues. It's truly due to the stigma, homophobia, transphobia that these individuals face on a day-to-day sort of scenario. So being queer doesn't inherently make you predisposed to having mental health issues. And again, LGBTQ plus youth are at an increased risk for victimization, violence, suicide, substance use, um, just because of people around them not being as accepting, not as welcoming. And as a healthcare provider, your job is not only to be smart, to know medicine, to know what you're doing, but to make patients feel welcomed, to make patients want to take your medical advice. So if you don't provide that sort of environment that allows them to feel welcomed, to feel like you truly do care about their health, you're not going to really make much of an impact on the overall society's health. Um, and then I reiterate this a lot, especially to some of my colleagues throughout my training, is that you don't you don't necessarily have to get or understand somebody's sexual orientation, somebody's gender identity, but it is your job as a healthcare provider to respect that. Um, you're not going to understand everything that goes on in life and the world around you, but you should continue to respect other people and provide them dignity. Like, they're coming to you for medical advice, for healthcare. As a provider, your job is to allow them to make informed health decisions and feel good about it. So, regardless of somebody's gender identity or their sexuality, address their medical conditions like you would anybody else. Um, there's no reason to feel awkward or uncomfortable about it. And if you have a question, you're allowed to ask questions, whether to your patients, to your colleagues, and just be sure to educate yourself. It never hurts to learn more. Another thing that I've been a good proponent of is HIV medicine, medications. Um, as primary care providers, uh, nowadays in 2021, HIV medicine is actually pretty easy to learn and manage those patients. And not everybody wants to go to a specialist. Some people truly just want to be with one doctor and get these sort of things taken care of. Um, so given things that have gone on recently, I do just want to reiterate these important points about HIV. HIV and AIDS are not synonymous. They are not the same thing as each other. HIV is a virus, and AIDS is a condition in which HIV can lead to, but 2021, there are plenty of life-saving medications these days that prevent people from developing AIDS. Um, and as another point to reiterate, neither HIV nor AIDS are terminal anymore. Transmission of HIV through sex, drug use, it can occur from mother to child during pregnancy, blood transfusions, but that's very, very, very rare these days, and needle stick injuries in healthcare situations. But since 1991, there has only been one case of that happening. And then the other big thing I love to push and talk to people about and educate them is on HIV prevention. We have great ways to prevent new HIV infections these days. HIV PrEP is a pill that you can take once a day to reduce HIV transmission by more than 90%, which is huge. HIV PEP, so PrEP stands for pre-exposure prophylaxis, so prevention, and then HIV PEP is post-exposure prophylaxis, meaning if somebody believes that they were exposed to HIV, they can take a combination of medications to prevent them from developing HIV in their system. And then the other huge thing, I think it was more discussed in Europe. It wasn't very well discussed in the US. Actually, this was something that I never learned in my own medical school, was U equals U, meaning that somebody living with HIV, if they take their medications every day, they can reach viral load levels that are undetectable. And essentially, once you're undetectable, you cannot transmit HIV to anybody, whether through sex, drug use, pregnancy, blood transfusion, or needle stick. So I think it's a really important thing that everybody should be aware of so that we can help decrease the stigma surrounding HIV. Um, and then I'm talking a lot. Does anybody have any questions as I'm going on and talking? Again, I spelled queer wrong. It's Queer. But these are some health resources that I recommend for people to look up. GLAMA, which is the Gay Lesbian Medical Association. Uh, that is their traditional organization name, but they encompass the whole gambit of LGBTQ plus health issues, and they advocate politically for LGBTQ plus health rights. If you live in the US and you're looking for a queer provider, if you to shadow or even for yourself, GLAMA also has a free provider search that you can utilize. And I even tell this to my non-LGBTQ plus colleagues and patients. Say that you are a healthcare provider and there is a patient that has a queer related health issue that you yourself don't feel comfortable with or are just uneducated on, and you want to provide them access to a provider who may be more comfortable, the GLAMA provider search is a great option to consider. WPATH, which is the World Professional or Association for Transgender Health. When I first started looking into treating transgender patients, I utilized their guidelines to learn for myself how to do hormonal replacement therapy, and it was a great, great resource for all of you who are getting into medicine. The Academy of HIV Medicine, that's how I got certified to do HIV medicine as a primary care doctor. You don't necessarily need their certification to treat HIV or do HIV management, but they do have wonderful resources and videos. If you're a med student, I believe, I haven't checked, but when I was a med student, they gave med students free membership so that you could actually utilize some of their educational content and some of their educational videos, which were really helpful for me as a med student. And then again, here in the US, there is an organization called FOLKS. They provide telemedicine services for those with and without insurance, for patients wanting HIV prevention, PrEP, as well as transgender hormone replacement therapy. They'll link them up with a provider through their telehealth system and get them the medications that they need. I see a question in the chat. Are the symptoms for HIV and AIDS the same? How can you tell? So typically, when somebody has HIV, you can have no symptoms to having some symptoms such as like a cold, a cough, a sore throat, maybe a fever for a week. So that's why it's very important if you are sexually active to get routine STI testing, including HIV testing, just so that you know your status. Symptoms for AIDS usually is somebody who's been having HIV for quite a long time and has gone undiagnosed, whether by just virtue of not getting tested or not wanting to get tested. Typically, patients with AIDS, they have a severe disease. They may have recurring fevers that don't go away, or they develop candidiasis, which is a yeast that you can develop in the mouth and in the throat and get severe infections from that typically non-immunocompromised people don't develop. Uh, or other such rare diseases, rare type of cancers that normal people don't typically develop if their immune system is working. With AIDS, it's that the HIV has gone on for so long that it's sort of depleted their immune cells and have allowed those opportunistic type infections to come on and attack the person. And I guess from a testing standpoint, to distinguish HIV and AIDS, you can look at markers such as how high the viral load is. Typically, somebody who is on their HIV medication will have a undetectable viral load, whereas somebody who's had it for quite some time without treatment, the viral load could be in the tens of thousands. Um, and then we also look at their immune cells, such as CD4 cells. And typically, again, with somebody who's on medication, their CD4 cells will be healthy and in a high number, as opposed to somebody who's been without medication for quite some time, and those CD4 cells drop drastically low. And so, yeah, I guess I went a little quickly. I just wanted to get feedback from you guys and see what other questions any of y'all had about medicine in general, medical school, residency, what have you. And if you had any specific questions, I could try my best to answer them. It doesn't just have to be about family medicine. And if you don't have any questions, that's also fine. I got a question. What advice would you give to a high school student hoping to pursue medicine? I think it's really important to have shadowing opportunities. It doesn't necessarily have to be in the specialty that you think that you want to do. I think just being in a healthcare setting office gives you sort of a taste and feel of what it's like in medicine. So I definitely recommend. I know it's kind of hard right now given the current pandemic, but I would really encourage you to look into shadowing experiences so that you get the feel of what basis. I would reach out to people who are currently in medical school to get their opinions and take on it, because things the way that it took for me to apply and process through medical school is going to be a lot different, even from like what, 7 years ago from when I did the process. So I would definitely try to get in touch, whether through social media or through family friends, talk to actual medical students right now, because they're going to have a lot better of a perspective on the application process and what you should do prior to applying to medical school than I will at this point. I got a question asking, do you believe that LGBTQ plus health disparities and inequalities should become an essential part of every medical school education? And if so, how would you go about educating students of said health disparities? Yeah, so there's actually a lot of health organizations that that encourage LGBTQ plus health disparities to be included in the curriculum. But unfortunately, there's no, I mean, I know the AMA exists, but there's no singular organizing body that makes medical schools and residencies follow a similar curriculum. So for example, per the American Academy of Family medicine residencies should be including as part of their core curriculum LGBTQ plus health disparities and HIV. I can tell you that that is not, they encourage it, but it's not followed. So for me, this was something that I was personally passionate about because as a queer youth, I didn't have uh, anybody to look up to in that respect. And so I think it's very important to just be open and honest in discussing those things for yourself. Um, in medical, like I said, in medical school, I really didn't get this education, so I didn't even know that it was truly a topic. So for me, it sort of picked up while I was in residency. So I did a lot of lectures on it in residency. I was able to go to multiple conferences and do lectures at conferences for other medical students and residents. Um, so one of my big takeaways from this whole medical school and residency process is whatever you're passionate about in medicine, it doesn't have to be the same thing I'm passionate about, but see what you're passionate about and utilize that. Talk to people about it. Do lectures on it. If you're in rheumatology and you have a specific topic that you love and you feel passionate about, do it for yourself, do it for others, and promote those sort of health educational points so that others can be more aware of it. Because it's great to have information for yourself, but it's even better when you're able to share it with other people and they can learn something from it. Um, how specifically I would go about it, I don't know. I like doing things like this to talk to pre-med and med students so that they're aware. I've done lectures with other medical students, and hopefully in the future I can continue sort of promoting this on different platforms so that people are more aware and that we can close those disparities. Good questions. What ultimately led you to pursue medicine, medical school, or was it more of a gradual decision? For me, it was sort of more of a gradual decision. Like growing up and doing like high school and undergrad, I liked science courses. So for me, it just made sense to go into medicine. Um, I kind of just went straight for the MD sort of avenue, but I really at the time I wasn't aware about NPs or PAs. So those are also very viable options if that's something that you want to pursue. I think for me is I prior to applying to med school while I was an undergraduate, I did shadow quite a few different doctors, different specialties, and I just liked it. It just sort of fit for me. And that's why I think it's so important. Again, I know it's hard because of the pandemic, but I think it's really important to do some shadowing opportunity so you can see for yourself if this is something that you would really like to do. Um, do you think there's a stigma with MD and DO degrees? What do you think your DO degree gave you in terms of skill sets that MDs may not have? Also, a wonderful question. So I will say over time, and as time continues to pass on, I think the MD-DO sort of stigma will get better. It's certainly 10 times better now, I would say, than it was when I first applied to medical school. When I first applied to medical school, I truly did not know MD versus DO. Um, I think that's mostly just a US thing. So for anybody not in the US, um, there are two medical doctor physician degrees, MD, which is traditionally allopathic physician, and DO, which is osteopathic physician. Uh, Back in the Civil War times, there was an MD who had learned different spinal adjustments and wanted to incorporate it into regular MD medicine at that time. So he made his own sect of physicians called DOs. And so, as a DO, over time, there has historically been a lot of stigma associated with DOs. When I applied to medical school, I applied to MD and DO schools. The DO school that I got accepted to was very close and it was convenient, so I went the DO route. As a DO, you do get all the same exact training, the same curriculum, you take the same exact board exams as MDs. But you do get extra training in osteopathic manipulative medicine, which essentially is different spinal and musculoskeletal adjustments. I get extra training in that. Some DOs continue to use it, some don't. I have continued to do OMT in my practice because patients like it. I enjoy doing it. Uh, when I was applying to residency, there was still a lot of stigma because there were two different governing bodies for the residency application process at that time. So historically, there were a lot of MD residency programs that would refuse DO applicants, uh, or they would make DO applicants do an extra year of training compared to the DO, to the MDs. Um, Nowadays, it's a unified body. They really can't discriminate like that like they used to anymore. There are so many DOs going into practice. So in terms of a DO, I feel like I'm just as qualified as an MD. All my MD colleagues would agree. The only difference is that I got a little extra training in spinal adjustments, which I like doing for fun for patients because it helps. Um, but other than that, I think as time goes by, since they've unified those two bodies for the residency application process, it will get a lot better. Do you believe that your study abroad trips gave you a competitive advantage when applying to medical school? It definitely gave me a talking point, which I will say that I don't think that's changed in regards to application and job interviews. People like people who can hold a conversation and have interesting things to talk about. So I think my study abroad trips gave me, overall, as a human being, it gave me a lot of perspective about the world in general. Living in the US, you don't see some of the things that happen in other countries. And sometimes other countries are very well off in other aspects that we don't have here in the US. On a personal level, I felt like the study abroad gave me a lot of perspective. Uh, in combination with my religious studies degree, it was great to see different aspects, walks of life, and how different societies function. In terms of applying to medical school, yeah, I felt like it was a little bit of a advantage because it gave me more talking points. And again, people who are interviewing you for med school, for residency, they love if you have interesting talking points that they can go on about. Is it financially available for everybody? Probably not. I was able to do some of mine through some scholarships. I applied to a bunch of scholarships for extra funding so that I could do these study abroad trips. So that's why I was able to do them. But I do understand that some of these trips are very expensive. But if you have the opportunity, I would highly encourage it. Thank you for the questions, guys. Can take a few more questions just so that we fill up the hour. Or I can start asking you guys questions. Mm.
Just so you know, we don't have to fill up the full hour. It's totally fine, but
No
it's
worries.
completely up to you.
Okay. I'll leave like a few more minutes for questions and then we can finish up. Do you ever regret becoming a physician? No, I don't ever regret becoming a physician. Um, Obviously, medical school is not the most conducive to your mental health. It is very hard, it is very expensive. Um, I'm in a lot of debt from medical school. Residency as well is very hard, it's very difficult, very strenuous. Um, and then even as attending, you struggle to get patients the care they need because of, at least in the US, how our healthcare industry is run. I don't ever regret being a physician. All the patient experiences that I've had, good or bad, the moments that I've shared with families, uh, being able to take care of people, providing them the care that they need that they never got before, uh, seeing the look on somebody's face when they get to see a doctor and they've wanted to transition and be on hormones their whole life and doctors have told them no, and they finally find a doctor who they're comfortable with and can be on those hormones with. um, there's a lot of things that you go through throughout the process of being a physician, and I wouldn't change it for the world. I truly am grateful for all the opportunities that I've had, and being able to have the platform that I have to support other queer, other Latinx individuals that didn't have somebody like me growing up. I didn't have somebody like me growing up to look up to. Um, so, yeah, there are a lot of hurdles to becoming a physician. But if it's something you're truly passionate about, you truly care about, and you can find ways for yourself to take yourself out of that negative headspace, and it's not easy by any means. At least in the US, resident physicians have some of the highest rate of suicides. So it's not an easy path, and I don't openly go out and tell everybody that they have to become a doctor. Um, but for me, at least, it has truly been rewarding, and the good has outweighed the bad. So that's my take. But yeah, I don't regret it. But I have met attendings that really that you could really tell they regretted becoming a physician. So make sure that it is the path for you. Um, Not a question, but I love your first shirt. Thank you very much. um,
Okay, we can end it here. Thank you so much, Dr. Tellez, for coming on. They've linked, if you want to put the Instagram back just so people can,
oh yeah.
yeah. But they've linked their Instagram there, so make sure you check it out. And definitely follow us on Medical Wonders, medical.wonders. We'll be posting more updates and stuff like that. And definitely please turn on notifications for the Google Classroom so you don't miss stuff. I definitely learned a lot, especially the queer side of medicine as well, because I also agree with you. I don't think it's talked about much.
Mhm.
Um, and I've seen it too with a lot of my family that's doctors, or they've gone through like similar paths with it, that it's just not taught a lot. So it's really important. I definitely learned a lot with HIV and stuff like that, and I'm sure all of you guys have also. But We're going to be ending the recording and the meeting here. Just a reminder, make sure you submit in that summary. If you're already here, might as well, or if you were taking notes as Dr. Tellez was presenting. And thank you so much for all the support. And if you have a friend or someone that missed it, we'll be uploading these calls really soon on YouTube as soon as possible. So definitely just keep an eye on Google Classroom because we'll be announcing that soon. But yeah, thank you so much, Dr. Tellez, for coming on.
Thank you
And
for
if you have
having me.
any last minute advice or any words or anything, you can definitely say it.
Yeah, no, I just want to say thank you for having me. It truly means a lot because, again, like I said, I never sort of got this sort of educational content throughout my career. So I truly do appreciate it when others allow me to have this platform to talk about it. So thank you.
All right, sounds good. Thank you guys so much for coming on. Just say thank you to Dr. Les for giving his time here. And yeah, we'll see you guys tomorrow.
Have a good one.
Bye.